Hi, this is a somatic practice for releasing the psoas, and you don't really need anything but some space to lay down. I've got a blanket on my yoga mat so that my foot will slide easier, so if you're on a yoga mat and not carpet, you may want to either move your foot onto the floor or grab a blanket to put on your yoga mat. And otherwise, come onto your back. So we're just gonna lay down. And if you wanna spend longer doing a little scan of your body, the soma scan or the sand print, please take the time to pause this video and just notice where your body is resting on the floor. I'm going to do like about a minute of just checking in, and all we're looking for is noticing where the body is connected to the floor, to the mat, and noticing areas that might be lifted away from the floor a little bit. And because this is a practice for the psoas, I would recommend checking in especially in the hamstrings and the low back area. Just noticing if there's a little bit of lift there, the back of the legs, the hamstrings. This is usually where we see a little bit of change in the body. Just take another few moments to check in, see where you're experiencing tension, where your body's feeling relaxed, where it's feeling neutral. And then we will check in and start with our movement. So to start off with, we're going to keep everything pretty relaxed here, other than what we're lifting off the floor. So we're going to be lifting our right leg up off the floor, and the tendency is going to be for the left side to really try to brace and hold that as best you can. Keep that left leg relaxed, and if you need to put a hand there just to kind of remind you, I do, so you can do that. So we're going to lift the right leg just to a hover off the floor, and feel how the psoas muscle, if you're feeling some tension starting right here, just feel how the psoas muscle is holding your leg up. And I'm trying not to use my left side. And just breathe into that. And then turn your toes a little bit to the right and slide your leg out a little bit to the right, maybe an inch or so. And just feeling that, how that changed the engagement of your psoas muscle to keep the leg lifted. And then with an exhale, either lower or even just drop your leg back down to the floor and notice what that does in your body. Notice what you're feeling on the right side of your body. And let's try that on the left side. So same thing, try not to use your right side too much. You can put your hand there if you need that. And then just lift your left leg to a hover and notice what's engaging to keep your leg lifted. You may feel some tightening in the back side of your body, and that's normal, but as best you can, trying to let the psoas muscle lift your leg up. And now turn your left toes to the left a little and slide your leg out over to the left, maybe an inch or so. Doesn't have to be too much. Notice how that changes the dynamic of your psoas muscle holding your leg up. And then again, with an exhale, either slowly release or you could just drop your leg down and notice what that does in your body. Just take a second to check in. Take a couple of breaths. And then bend your knees and bring both your feet to the floor. And we're going to do some bicycle movements. So you can keep your arms beside you. I'm going to bring my hands behind my head just because that feels a little more comfortable, and we're going to be here in a minute anyway. So you know your arch and curl, the inhale arch, exhale curl or flatten. So as you exhale, you're going to lower and curl your spine down to the floor, and then just bring your knee in towards you. So that's the first movement. I'm actually going to release my arms back down. And now just start to straighten your leg up towards the ceiling. Go as slow as you can, like really, really slowly. And this part, it's not as connected to the breath, so maybe start to lower on an exhale, but you're gonna have to breathe in as you bring your leg straight and start to lower it down to the floor as slowly as you can. And then once it comes to the floor, just let your leg relax and take a breath. And then draw your foot back to your starting point. We're going to stay on the right. So as you exhale, curl your tailbone, lower your low back towards the floor, and bring your knee in towards your chest. And then starting with your inhale, you can slowly start to straighten your leg up towards the ceiling, like you're riding a bicycle, like it is supposed, the bicycle, the pedaling action. You're gonna have to breathe in at some point. So once your leg is straight, just as slowly as you can, lowering it down towards the floor. And if you need a little bend in your knee, that's okay. So bringing it down just as slow as you can, and then once your leg finds the floor, let it relax, let everything go. And then return your knee back to center. And let's go to the left side. So same thing, you're gonna curl your tailbone up and roll your spine down a little bit with your exhale and pull your left knee in. And then starting with your inhale, start to pedal like you're straightening and pushing on a bike pedal. You may even want to kind of push through your foot to find that. And you'll have to breathe in and out. You're slowly lowering that straight leg down towards the floor. You may notice some jerking or some wobbling. That's totally normal. Once the leg reaches the floor, relax, let everything go. And then slide your foot back in. And we'll do that again. As you exhale, curl your spine down. Your tailbone might lift a little to tucking. Pull your elbow, your knee in. And then as you inhale, start to push your foot up towards the ceiling, straightening your left leg. And then slow as possible, lowering your leg slowly, slowly, slowly down. And once you find the floor, just let it relax, release your leg, and then draw it back to center. Okay, so the last part of this, there's just 3 exercises. It's a quick little psoas release. Bring your hands behind your head. And this one we're going to do a little more of the curling in. So as you exhale, you'll curl your spine down and pull your right knee in, squeeze your head with your elbows and pick up your shoulders. And then slowly with your inhale, start to release, lower your right foot back down and slide your leg as slowly as possible straight, opening your elbows. You might need to breathe in once you get there. And then once everything's down, just let the leg, the arms relax. And then draw your leg back in to your starting point. And so we'll do that again. We're going to change the angle of the legs. So listen carefully. So as you exhale, tuck your tailbone, curl your spine down, squeeze your head, start to lift your shoulders and draw knee and elbows towards each other. And then as you inhale, start to release that back down. Head comes down, foot comes down slowly. Once the foot finds the floor, you start to open the elbows slowly and straighten your leg, turning it back down. So I missed a spot. We're just going to do that twice to neutral. Let it relax, and then return to center. So this time there will be a change. So as you inhale, I was getting carried away and like, oh, that feels good. So as you inhale, just relax. And then as you exhale, curl your spine down, squeeze your head, bring your elbows and your knee toward each other. And then turn your right toes out to the right and slowly start to release. You can start on an inhale. Once your head comes down and your foot comes down, keep that external rotation of the legs, open the elbows, and then just start to straighten your externally rotated right leg as slowly as possible. And then just take a breath there and let everything relax. Then keep that external rotation as you draw your leg back into center. We're going to do that again, this time internally rotating the leg. So as you exhale, curl your spine down, squeeze your head, pull elbows and knee toward each other. Then turn your toes in. So there's internal rotation of the right leg happening already. As you inhale, lower back down. Once your foot finds the floor, start to slide your internally rotated leg out. Let your elbows slowly open. And then once you come down, just let everything relax. As best you can, try to keep that leg internally rotated. And then with the internal rotation, inhale and slowly slide your leg back to center, or back to starting. And then we'll go to the other side. All right. So take a breath in, let everything relax. And then as you exhale, curl your spine down, elbows come in, pick up your left knee and pull knee and elbows towards each other. And then as you inhale, keeping your leg neutral, slowly lower your head and your foot down. And we'll start to slow as possible, slide the leg out, open the elbows, and then once everything finds the floor, just let everything relax. And then slowly come back to neutral. We're going to do that in that neutral place again, no internal or external rotation. So as you inhale, relax. As you exhale, curl your spine down, squeeze your head with your elbows. Elbows and knee come in towards each other. And then as you inhale, slowly release. Foot and head find the floor. Start to slowly open things up, straightening your leg out. And once you get everything extended, let it relax. And then return back to center, inhale. Now we'll add the external rotation. So take a breath in, and as you exhale, squeeze, curl your spine down, elbows towards knee. Once you get there, externally rotate your left leg. And with your inhale, start to lower things down, keeping that external rotation. Once the foot comes down, start to slide your leg out in that external rotation and open your elbows. And then once everything's extended, let it relax. Take a breath in. Keep your leg externally rotated as you draw it back to center. And then we'll go to internal rotation. So as you inhale, relax. As you exhale, curl your spine down, squeeze your head, elbows and knee toward each other. Find some internal rotation of the left leg. And as you inhale, slowly lower down. You might need to breathe in and out as you do this if you're moving slower than your breath, which is fine. Just start with your inhale or exhale with the instruction and then breathe as you need to. Keep that internal rotation as you stretch your leg out. And then once you're extended, let it relax. And then with an inhale, keep the internal rotation and start to bring your legs slowly back to your starting place. Release your head, release your arms, and just stretch both your legs out again and see what you notice doing that soma scan or that sand print. And you might feel some areas of your body more in contact with the floor than you did when we began. So for me, my back is feeling a little more relaxed on the sides. I'm feeling a little more touching of my hamstrings with the mat. I probably could do a few more rounds of that and loosen it up a little bit more, but it's just a quick practice. So feel free to add that in if you want to do another round of all of that. That might be helpful. And also feel free to take a little shavasana here and let yourself rest for the next few minutes or so, just letting yourself be with whatever sensations are arising in your body. And I thank you for sharing your practice. I will see you next time. Thanks.